Metta Protocol utilizes the frameworks of Buddhist psychology and EMDR therapy to create a complete and primary clinical practice system. And this has come from the research that shows that having a mindful lifestyle or creating a mindful lifestyle is the best way to improve mood, decrease anxiety, and just be more successful overall in life. So for people who suffer from addiction or other mental health situations, there's usually, if not always, an underlying trauma. That could be a big T trauma or small t trauma, or another way of framing it is trauma or adverse life events that needs to be treated in order to bring long-term sustainable health.
Metta Protocol treatment centers and group practices are just much more successful operationally overall, and this is why. When we train a center to use the scaffolding of the Metta Protocol, we are working with all staff to really shape the culture to be more trauma-focused and mindfulness-based. We're not only training the clinical staff in EMDR, trauma modalities, mindfulness modalities, but we're training all staff members, the administrators, the people who are answering the phone, the drivers, the people in the kitchen, and especially the mentors and the frontline staff. And we're making sure that they all understand the principles of trauma awareness and mindful lifestyle development. And when the full staff is on the same page in this way, and they're continually concerned with the emotional well-being of one another, as well as the emotional well-being and the healing of the clients, something really magical starts to happen within the treatment center culture.
So with the Metta Protocol, the milieu calms down and it's easier to work with, even working with the most clinically complex clients. And that's because they're consistently met with staff members who know how to keep themselves calm, they know how to de-escalate situations, they know how to meet clients with unconditional positive regard without feeling taken advantage of or getting worn out. Educating staff about right speech, right action, right livelihood, right effort. It creates a compassionate and boundary-oriented work environment in which the staff feel safe, they feel supported, and they feel respected.
So the treatment center culture begins to feel really wonderful, and treatment owners suddenly have more money in their pockets because staff turnaround is much lower and people love to come to work and stay at work. Insurance reimbursements flow more easily because the entire clinical system is based on an evidence-based protocol, EMDR. And because Metta also understands the importance of long-term treatment and providing support for clients even after they leave treatment, the alumni programs become more robust. And so the networks of the treatment centers grow, and that's also wonderful for the bottom line. Clients are getting better at a higher rate, treatment gains are lasting longer, and the treatment is feeling more financially sound. It's a win-win-win.
It has been our mission for decades now to end as much suffering for as many people as possible. And from that mission, Metta Protocol has been born. We're excited about the many centers we're already working with throughout the country, and I'm happy to talk with you about trainings and ways to work together to make your center be the best that it can be. Together, we can end suffering.